Cityscope is produced by KPDX Fox 49 as a forum for diverse points of view on topics impacting citizens in the Pacific Northwest. The opinions expressed by guests and commentators on Cityscope are not necessarily the views of Cityscope producers and the KPDX management.
Good morning and welcome to Cityscope. I'm Eric Schmidt. First up on this edition of Cityscope, how the medical community deals with the difficult issue of domestic abuse. At least one HMO, health maintenance organization here in the metro area, is asking its physicians and nurses to take a more active role in reporting suspected cases of domestic abuse, and they also want those professionals to follow up on those reports. Marna Flattery Robb is the Regional Services Manager for the Kaiser Foundation Health Plan. I hope I got your name right.
Marna Flaherty Robb.
Flaherty, there you go. I'm not very good with Irish names. But she's the Regional Manager for Kaiser Permanente, and you are very much involved on the front line of this issue. First of all, Kaiser is the first HMO. It's the biggest HMO in the state, but it's the first one to ask its health professionals to take a serious role in this reporting of domestic abuse. Why did you decide to do that now?
Kaiser Permanente, as a program, as you know, has been in this community for almost 50 years, and we have a long-term interest in improving the health and welfare of families. We specifically are concerned about public health and safety. We have looked at the notion of unintentional violence as a part of safety problems in our community for a long time, such as the use of helmets, the use of safety belts, the use of prevention of ingestion in children. The area of intentional violence has received a lot of attention at the national level as a legal issue and as a public health issue, but less focus as a health risk issue of major concern, as a medical issue, deserving of regular attention in regular health maintenance visits at times in which members appear with injuries. We've also found that it is underdiscovered behind-the-scenes problems in many of the presentations of our women and families in the area of presentations with anxiety and depression. In multiple injuries, we have found in the literature, in our experience, and other organizations that women who have been identified as being victims of partner abuse or spousal abuse have been seen in emergency rooms up to 7 times prior to reporting of that issue.
Wow. So they'll go in 7 times before it's actually identified that
Yes.
the reason that they've been there so often is because they're being beaten up.
That's right. And in these situations and in trauma situations, which are more obvious demonstrations of abuse, but there are a lot of more underlying, more subtle presentations in the area of abdominal pain, in the area of multiple obstetric gynecology problems, in the area, as I said, of anxiety and depression, and multiple use of resources in the community without the proper identification of what is the true problem we're seeing.
How serious is this problem? How pervasive is it?
We think one of the issues that I do have to say right up front is because it's been so underreported and because it's part of our secret problem in families, we're not sure of what the incidence is, but we do know some facts and we can predict some things. We think at least 15 to 20% of emergency room visits may involve the potential of domestic violence.
15 to 20%?
Yes.
That's a significant amount.
Very, very significant. We know that where domestic violence occurs in families, when the woman becomes pregnant, it increases 20 to 25% more within the prenatal period because there's a perceived threat on the part of the abusing partner of the birth of this child and the intimacy within the relationship. And in fact, in a recent study conducted within Kaiser Permanente over the last year, where we were working with our hospital staff to take care of women at home who had had a previous history of delivering low birth weight babies, fully 75% of those women being managed by our home health service in the home were discovered to have abusive relationships, which was the underlying cause of why these babies were born early. So those are some indications.
This is an expensive problem then.
It's a very expensive problem.
And it's a preventable problem.
We think it's preventable. We also know it's only the community as a whole can make a difference in this. It's not the legal system's problem. It's not the school systems problem. It's not just health care. We, the community as a whole, and that's why Kaiser Permanente has chosen this area, along with Safe Kids and other areas of unintentional injury, to work with our community partners, our alliance hospitals, our other health, Oregon Medical Association, American Medical Association, pediatric societies, because only together can we really make a difference.
Okay, let me ask you how the medical community is reacting to this, because traditionally they've been rather reluctant to report anything to the authorities, be it child abuse, domestic abuse, or any other kind of abuse. They'd rather deal with the patient as the patient.
Yes, and our first area of effort in this, actually, it is now still not required reporting legally as child abuse and elder abuse is. I was speaking with some of the trauma surgeons in our trauma centers in our community right now, and it is still not, the source of that violence is still not a reportable activity in other than those two areas, elder and child abuse. So what we are trying to do as a joint community health area is to make sure that we have common methods of assessment and case finding so that we can properly identify whether the causes of what we're seeing are related to this area. We still don't have requirements for documentation to regulatory agencies. We think our first effort is to inform and to educate of how prevalent this issue is in the community. The Oregon Medical Association over the last 2 years has done an enormous amount of education to all of its clinicians, sent out huge brochures and informational packets to have them be more aware. But I think you're correct in saying that there is a reluctance, and there's a reluctance for several reasons. One, first of all, there has not been a history of training and education to these clinicians and how to go about asking these questions.
Not taught in medical school, is it?
That's right.
Yeah.
They're worried and nervous about that, as we were in the early days of 1983 and 1984, and doing very good sexual history taking during the AIDS, the first discovery of AIDS. So this notion of having people well-skilled and understanding and intuitively feeling comfortable in asking good questions. The second issue has been they feel that if they ask the question and they get the yes answer, they will be overwhelmed with what those problems are, and they won't have resources to help these women.
And they may themselves not be qualified to take care of that.
That's exactly right.
Let me, since we have about a minute left, I want to turn it the other way. If Kaiser and other HMOs and hospitals get involved in this in a first-class way, which you are, is this going to make it the patient less reluctant to go to the emergency room knowing that a doctor will report domestic abuse?
Well, right now, what I think our patients who have been told us that they have been in domestic situations is that they wish they would have had a comfortable situation in which clinicians cared enough to say, this area is important to us, we consider it a health risk, we want you to tell us whether this is a situation in your life so that we can help support you and get you ready to make the decisions you need to do. Right now, the focus is on having the clinical relationship and the trustful relationship happening. Most victims feel that if they were asked it earlier, they would have talked about it and would have gone.
So in fact, there probably will be more people going into the emergency room knowing that they won't have to blurt it out, that it will come out in the questioning.
We're hoping that it's going to occur before they have to go into the emergency room. We're hoping they'll come into their regular health maintenance visit with a trusting physician and say, I really need to talk about this.
And it happens every day.
Yes.
Thank you, Morna, for being with us. We really appreciate it.
You're welcome.
Good luck to Kaiser on this program, too.
We appreciate it.
We'll be back.